Hi, my name is Rebecca and I'm a graduate teaching assistant at the University of Kentucky. In this lab, we'll be reviewing principles and methods of measuring body composition, specifically using bioelectrical impedance, or BIA. BIA is a non-invasive measurement that allows us to estimate fat and fat-free body composition. Learning how to perform the BIA measurement and interpret the values are critical in a variety of settings, including clinical professions such as nursing, PT, cardiac rehab, strength and conditioning, such as coaches and personal trainers, and in research. Therefore, the purpose of this lab is to become familiar with the procedures and perform a BIA measurement on a potential client. We will cover various types of BIA machines and how to calculate and interpret the values each machine gives you. After this lab, you will be comfortable and confident in how to perform a BIA test and with applying the results to an exercise prescription. Body composition can be measured through a variety of unique techniques ranging from skin fold thickness to more in-depth techniques such as the DEXA. Each technique has a unique component that it used to derive fat versus fat-free content. The DEXA focuses more on bone mineral density, whereas a BIA will focus more on total body water. Even though the human body is made up of many types of tissues, such as muscle, bone, fat, and water, we often divide these into two compartments: fat versus fat-free mass. Fat mass is composed of essential fats, such as lipids in the bone marrow, and non-essential fats, like stored triglycerides. Fat-free mass is composed of protein, like skeletal muscle, water, and mineral, such as bone mineral. However, today we're going to focus on bioelectrical impedance and use this method to measure body composition. The BIA technique depends on the body's conductivity of high-frequency electrical current. We have electrical properties in our tissue, and the BIA measures the electrical currents that are constantly running through our tissue and the resistance at which it's met with. When you think of impedance in the bioelectrical impedance method, we want to think about the resistance. The body's fat-free mass is approximately 70 to 75% water, which we know is very high in electrolytes and will conduct the electrical current at a faster rate compared to fat mass, which is about 5 to 10% water. Therefore, the electrical impedance gives us an index of total body water. First, because a higher water content in the fat-free compartments is far more dense than the fat, and it is a good conductor of electricity, which yields a low impedance. Second, the fat compartments are far less dense and are poor conductors of current, resulting in a higher impedance. Because body composition and their analysis are highly variable, it is hard to get a measurement that is 100% accurate. So in today's lab, you will see 4 different BIA methods and then compare the results. Because the BIA method is based on total body water, it is important for subjects to follow the guidelines before testing to get the most accurate results. Your subject should fast for at least 4 hours prior to testing. The subject should not perform any type of exercise within 12 hours of testing. It's important that the subject urinates within 30 minutes of testing, and that no alcohol is consumed within 48 hours. Begin the lab by taking and recording the height and weight of your subjects. Have subjects remove both shoes for these exercises. Next, have the subject remove the right shoe and right sock. You will then move to apply 4 surface electrodes, 2 on the right hand and 2 on the right foot. The hand electrodes should be placed between the styloid process of the radius and ulna and just above the metacarpal joint line. The right foot electrodes should be placed between the medial and lateral malleoli and just above the metatarsal joint line. Not every BIA technique requires electrodes, but we're going to talk about 2 whole body BIA methods that we'll need. Method 1, the RJL BIA 101. You will first have your subject lie supine for approximately 5 minutes before the impedance measure is made. Knees should be extended and spread so the thighs do not touch. The arms should be extended by the side of the body. Ask the subject to relax and breathe normally, then you'll proceed to connect the electrodes. Ask the subject to relax and breathe normally while you connect the wires to the electrodes. For the RJL, connect the red cable to the proximal electrode on the hand and foot, and the black cable to the distal electrode on the hand and foot. Always place and connect the wires on the adjacent lateral side. RJL, there are two switches on the front of the analyzer. One is the range selector and should be set at 0 to 1000. The second switch is used to move between the resistance and the reactant. When you change this switch, corresponding numbers will appear. You will record these values on your datasheet. Allow a few seconds for the recordings to stabilize before recording the results. Normal adult values for the resistance falls between 250 to 800 ohms. BIA method 2, the body sat 1500. You will use the same electrodes from the RJL test. Have the subject lay supine with the legs and arms extended and ask the subject to relax and breathe normally. This time you will connect the red cable to the distal electrodes and the black cable to the proximal electrodes. Once the connections are made, you will begin the test. The BodySat 1500 will provide measurements for impedance. You will also be provided with values of your subject and the normal ranges for their age, sex, and activity level. You will be given a fat percent, a fat mass, a lean percent, a lean mass, dry lean mass, total weight, which is input by you, BMI, total body water percent, and total body water volume. Now make sure you record the values that we mentioned previously. BIA Method 3, Omron Body Logic. This is a hand-to-hand or upper body BIA device that estimates body composition from the standing position with feet positioned shoulder width apart. Hold the Omron in a firm grip with arms fully extended in front of the body. You will enter sex, age, height, and weight. Hit the start button and let it run. It will give you a percent body fat and BMI. For this particular test, you will use the percent body fat to calculate fat and fat-free mass. BIA Method 4, the Tanita. A foot-to-foot, lower body BIA device estimating body composition from the standing position where the subject stands on a scale-like device. All measurements are taken from the standing position and feet should be bare, clean, and dry. Position the feet so that they're covering the electrode plates and pads. You will enter the activity level, sex, age, and height of your subject. Weight is measured simultaneously. Make sure you're recording the weight and the body fat percentage the Tanita gives you for your analysis. Now, the purpose of this lab was to become familiar with the BIA techniques to measure body composition. This lab will allow you to compare and contrast the body composition measurements for percent fat, fat-free mass, and fat mass. Since we obtained these values from different BIA methods, you can determine which method provides the best estimation of body composition. Remember, body composition is more than just fat and fat-free mass, but these values are important and can be used by exercise physiologists, nutritionists, and physicians as an indicator of health status.